Hi. So my name is Ashley Brennan. I live a half hour away in Westchester in Bronxville, New York. I'm here with my husband, Alec. It's right there with our daughter, Louisa. Before I get into my family's journey with our ALD diagnosis, I just want to say that my intro to X-linked ALD began much earlier. When I was about 10, the movie Lorenzo's Oil came out, and I remember watching it. Maybe I rented it, maybe it was on TV and I watched it and I wasn't supposed to. But I remember being completely captivated by Lorenzo's story and how such a smart, healthy little boy and his family could be so devastated by a genetic disorder, and how at the time there was so little known about it. I don't know why that story left such an impression on me so early on, but I had no idea that 3 decades later I'd be dealing with my own family's ALD diagnosis. Fast forward to present day, and this is our family, as I said. I'm Ashley, Alec, Olivia is 13, Maisie is 3 years old, and Louisa is 9 months. I just turned 43 on Tuesday, actually. Olivia is from a previous marriage, and my husband and Alec and I share Maisie and Lulu. Okay, so Louisa was born on June 26th of 2024 at approximately 10:30 a.m. at New York Presbyterian Hospital in Bronxville, New York. She's my 3rd child, and we call her Lulu for short. I had what many call a geriatric pregnancy, which is a term I really hate. As I said, I'm over 40, and I dealt with thyroid issues, which is why my husband and I eventually had to turn to IVF to get pregnant. I remember turning to my husband just before Lulu was delivered, and was for some reason very fearful that she wouldn't latch. She quickly proved me wrong and had the strongest, fastest latch of any of my daughters. Louisa came from a genetically tested frozen embryo, the same retrieval round as her older sister, Maisie. We chose the name Louisa, which means warrior, because she really did beat all the odds to come into this world. And she has come to prove time and again how fiercely she lives up to her name. So, okay, 3rd slide. Wait, is that right? Okay, yes. So July 3rd is the day that my world came to a complete standstill. I was still recovering from my C-section. I was sleep deprived, and I was getting into the overwhelming routine of having 3 daughters all under one roof. So first, New York Presbyterian in Bronxville called us, and the person on the other end of the phone sounded a bit frantic. They said they didn't have a pediatrician on file, and they asked if Louisa was eating. I thought that was a bit odd, but really didn't think anything of it, because we had just been to the pediatrician the day before, and everything was fine. Later that evening, I got a call from Dr. Jose Morales with the Pediatric Genetics Center at Columbia University Medical Center in New York. I remember as soon as I heard that, my heart was pounding in my ears and my fingers went numb. I knew something bad was coming. I put the phone on speaker so my husband could hear as our newborn baby daughter was napping in the next room, and he proceeded to tell us that Lulu's very long-chain fatty acid levels from her newborn screening test came back elevated. I vaguely remember this newborn screening test. It happened during one of the many times hospital staffers whisk your baby away while you're recovering and more or less in a drowsy state. They draw blood from the baby's heel. In our case, no one really explained what they were looking for, but they said we'd get a call if there was something of concern, and they assured us there probably wouldn't be. So again, I didn't think about it because Lulu's embryo was genetically tested, and surely that meant everything was fine. I was wrong. So we pressed Dr. Morales for more information about what kinds of conditions are associated with high VLCFAs, and he was honest, informing us about paroxysomal disorders like the Zellweger spectrum or X-linked ALD. We were advised to come in for further testing to verify if Lulu did in fact have anything wrong, and if she did, what exactly it was. We were also told that Google was not the best course of action, but we Googled anyway. It's a horrible choice. I don't recommend it. We were faced with outcomes that ran the gamut. Some could mean Lulu wouldn't see her past her 1st birthday. To the other end of the spectrum, a benign genetic variant where she was completely fine with no symptoms. The information was all over the place, and that caused my emotions to be all over the place. When we spoke to our pediatrician, she seemed to believe that the diagnosis was X-linked ALD, and that we had the 2 X chromosome design on our side in terms of Lulu's prognosis. So although we got conflicting information at first, we were encouraged to go for the testing by all parties. We made an appointment in New York City to see Dr. Morales to figure out what was going on with our little warrior. When we met Dr. Morales and Caitlin, the physician's assistant, my husband and I were hoping that nothing was wrong. But if there were an issue, it would be X-linked ALD, compared to what we saw on the internet. I remembered the name of the condition because of the movie Lorenzo's Oil, and I, like many people, still believe that XALD only affected boys. Dr. Morales explained that the carrier title was a misnomer, and that it's now believed women who have XALD will develop symptoms with age. And having two X chromosomes might help mitigate the most severe forms of the disease, but women who have pathogenic ABCD1 gene mutations typically develop certain aspects of the disease as time goes on. But we still didn't know. We had to figure out what she had definitively. So we started with a blood draw that would be used for various tests, including the VLCFA gene panel analysis. And there is nothing more painful than sitting with your newborn while the phlebotomist has to draw blood from their tiny veins. Lulu was not a fan. Mom was really not a fan. Another part of this appointment included giving a family history of any diseases. But Alec and I had been genetically tested before going through IVF. Our embryos had been genetically tested before going through IVF. So I never understood how we got there. Here we go. Oh. So Lulu's blood results came back about a week later. It was a really long week, and I took lots of walks. We didn't tell my family members at this point because we didn't know what we were dealing with. When I opened the results through the patient portal, my heart sank because their VLCFAs were still out of range, specifically the C26 and the C26-22 ratio. One silver lining was that the blood markers for other conditions, which I Googled, full disclosure, were in normal range. However, we were cautioned not to rule anything else out because we were still waiting on the VLCFA gene panel analysis from Invitae, did I say that right, to come back. So I do remember when the results were available for the gene analysis in the portal. It took me 5 days from when they were available until I was able to open them. Finally, I knew it just had to be done, so I went to the living room by myself, unbeknownst to my husband, and I opened them. So those took about 3 weeks to get back to us. And so if you see at the top, this is what I saw. There was something called Krabbe disease, which I panicked about because through Google, the outcomes were not optimal. But Dr. Morales explained that she did not have the condition. It was benign, a pseudo-deficiency allele, and I'm not going to pretend to know what that is, but we didn't have to worry about it. Lulu did, however, have a pathogenic ABCD1 gene variant, which indicates X-linked ALD. She has a gross deletion of exons 8 through 10 on her ABCD1 gene, and at this point, the test was inconclusive about whether the deletion encompassed other genes. Dr. Morales suggested that Lulu return for an array test to see how far the deletion went, and also suggested that we as a family get tested to see if any of us have the condition. On one hand, I was relieved that we were not faced with a fatal condition, but the large deletion scared me because it still meant more uncertainty. So I did what I swore I'd never do again, and I Googled. Bad choice. So we returned to Dr. Morales' office a few weeks later. We all got buccal swabs with the exception of Olivia. Since I had her in my previous marriage, I wanted to spare her some of this if she didn't need to be involved right away. Lulu got an array, Alec, Maisie, and I had our blood drawn and had our ABCD1 gene analyzed. We also went through a more thorough family history, and knowing what symptoms XALD usually bring about in women, I was convinced that this was on my side of the family. There was history of female thyroid issues, bone density issues, you name it, I was convinced. And part of me was happy that it could be inherited from me because I figured, well, I've lived a very active life, fairly problem-free. Lulu will too. But I soon learned that that was not accurate because the same variant doesn't mean the same symptoms will manifest from one person to the next, even within the same family. So just when I think I have a relatively clear understanding of this condition, I'm swiftly reminded that I don't know what I don't know, and there's so much not known. At any rate, more testing meant more waiting, which is truly the hardest part of this whole process. In September, we got Louise's results back. Caitlin called us to let us know that the deletion was confined to her ABCD1 gene, which was good news. A bit later, we learned that Maisie, Alec, and I all had normal ABCD1 readings. We didn't have the disorder. Louisa is a de novo case, which I'm told, yes, by Google, is exceptionally rare. I was at once relieved and upset. I wanted someone to blame for this, but it was just something that spontaneously happened, even with all the preemptive genetic testing. So what does this mean, and where do we go from here? Receiving a diagnosis of XALD in a de novo newborn girl is very strange. I don't have another or a better word for it. Newborn testing and the conditions it screens for, well, they're meant to catch things quickly that you can treat and improve outcomes. With Louisa, right now, there's nothing to treat. Her symptoms, if she develops them, will likely come later in life. I decided I wanted to learn everything I can about XALD so that when the time comes, I can help Lulu make her own medical decisions so that she can be her best advocate. I no longer use the word carrier for girls with ALD because most will not stay symptom-free. I use pre-symptomatic or asymptomatic. For some reason, this helps me accept her diagnosis a little bit more. Still, my husband tells me I did not put Lulu down for the first 3 months of her life. Acceptance doesn't make the reality any easier, just different. Caitlin provided me with some ALD support groups that I immediately got in touch with, ALD Connect, Remember the Girls, and of course, the ALD Alliance. I will never forget when I got the call from Miranda. Sorry. I was running through Grand Central after work, and I remember just breaking down and allowing myself to be completely vulnerable with this stranger. And I never wanted to reach through a phone and hug someone more than I did at that moment. This is a rare disease that we're dealing with, but for the first time, I did not feel alone in it, and that matters, especially when you want to fight for your kid. So I think newborn screening is so vital, and I can't say it enough. Even though Louisa does not have something to treat right away, I'm glad I'm aware of her diagnosis. I didn't always feel that way. I was angry at first, but I realize now there is an opportunity to learn from her and with her, and to set things in motion for her so that she can make the best choices for herself. Family planning is a big one. Should Lulu want to have children, I want to have the option of IVF so she can reduce the chances of passing on the condition to her children. I also hope that should she develop symptoms later in life, that having this early information will spare her some of the painful diagnostic journeys that I've heard about that can take years in some cases. As they say, knowledge is power. I'm not a scientist and I'm not a doctor, but common sense would dictate that as more newborn screening is done, it will broaden the pool for infants with XALD. This could help give more accurate numbers around studies when it comes to women with ALD. And I read everything from females don't have symptoms because they're carriers to 90% of women with ALD experience symptoms that could be mild to severe. There's so much misinformation out there and so much conflicting information. The clinical trials give me hope, even though I know many of them are mainly geared for boys because the disease severity is greater for them. But women are patients too, and we're part of the ALD community. Looking back, I wish I had more education around newborn screening because it was almost swept under the rug at the hospital. It wasn't really discussed, it just kind of happened casually. But for those of us who get the calls, it is life-changing, and early testing and diagnosis saves lives and also improves them. So, in February, at 7 months old, we took Louisa for a follow-up with Dr. Morales. She's healthy, happy, hungry, and noisy, as you can hear. Her love of mashed potatoes is definitely something she inherited from me. She's also extremely anti-tummy time at this juncture. She can and she will do it, but only if there is really excellent toy just put out of reach. I realize that we are fortunate to live in New York City and have access to such wonderful medical facilities and physicians like Dr. Morales and Caitlin, who were able to tell us accurately what we were facing. We had a relatively straightforward path to diagnosis, and I know in many parts of the country they do not. While I don't know what will happen going forward, we did tell Dr. Morales that we want to learn as much as we can about Lulu in this process. And if that means annual checkups and blood draws in person at the Pediatric Genetics Center, then so be it. I'm interested in helping however I can to establish a standard of care for girls because right now the jury is still out on that. Does it make sense to get a baseline MRI at 18? Some say yes, some say no. There's room for improvement, and I think newborn screening will play a huge role in that. I have hope that one day in a not too distant future we will have a way to fully treat XALD in boys and in girls. I still grapple with how and when to tell Lulu about her diagnosis. I don't want her to be the last to know, but at the same time, it's a lot for someone to learn about themselves. At some of the discussions I've listened to among pre-symptomatic women with ALD, they say if given the chance, they would want to learn about their condition around the age of 16. I'm not sure I can wait that long. I figure the right time will reveal itself, and this diagnosis is just part of her birth story. For now, I'm just trying to live in the moment and stay thankful that Louisa is perfectly healthy and happy and hitting her milestones. She really is a little warrior, and I will remind her of that every day. The best piece of advice I have received so far is just to go and enjoy my daughter, and so we are. And there she is at her follow-up checkup, and that's really all I have. So thank you for letting me speak.